water in Guayaquil. This is in, did I say that right?
Guayaquil.
Okay, sorry. This is in Ecuador. The inspiration behind it was Marissa, she served her mission in Ecuador, so we thought it would be really neat to be able to create an intervention for that area since Marissa's been there and kind of seen firsthand. So the people in our group are Marissa Banner, Corinne Chilton, Mackenzie Pettingale, and Millicent Tango. Next slide.
Did it go to the next one?
Yeah.
Okay.
So Guayaquil is very diverse population-wise. There's a thriving metropolis, and also there's very rural parts of it. So in the urban areas, the piped water service inside the house was 66%, and in the rural areas, there was only 14% access. There's 6 million people in Ecuador who do not have access to water in their homes, and 8 million people lack proper sanitation. Because of the lack of clean water, it creates a variety of health problems for the people there, like diarrheal and intestinal diseases, parasites, and even death if it gets that bad. It also impacts economic productivity and keeps people in the poverty cycle. Many cities lack an adequate sewage system, and much of it ends up in the rivers and in places where people collect their drinking water and bathe from. These unsanitary water conditions increase the risk of catching waterborne infections like cholera, typhoid, and hepatitis, because much of the people, because of the weather, swim in that contaminated water. Next slide.
We just thought that we would show everyone the difference between the metropolis of Guayaquil and the rural areas where the people are really poor and they don't have access to clean water. So for our intervention, we thought about ways that we could clean up this river, since this is the main water source for these people that live here. And so we decided that helping people to have an adequate place to use the restroom would be a good first step to starting to clean up this river, because the people lack adequate facilities. A lot of their waste ends up in the river. And so Guayaquil is a really big city with 3.5 million people. So obviously in the metropolis, it's they already have access to plumbing and to facilities to use the restroom. And so we wanted to start in the more rural areas. And so our goal is to start building these small, simple outhouses through the rural areas so that people can adequately get rid of their waste without it ending up in the river. And so our goal would be to start with 40 of these small outhouses to help these people understand that that is the first step to keeping their water clean. And as a follow-up, maybe in the future, more educational programs to teach the natives how to keep the water bodies and their environment clean. And another thing that we thought of was eventually trying to organize volunteers, natives, to start cleaning up the garbage around the river and trying to help them to understand that that's really important to keep their water clean. So this is a little diagram of what we thought of for building the small, simple outhouses. So it starts with digging a hole where the waste can go, and just building a simple structure to give them privacy and So yeah.
So the reasons why our intervention will solve the problem is kind of what we've said before. As you can see in these pictures, these are sewage pipes that run directly into the river. And so you can see how that would just be a complete problem with literally the waste going straight into the river. And even in the rural areas, they obviously don't have sewage systems. So they just end up dumping, whatever type of thing they use right into the river. So the unsanitary water conditions increase the risk of cholera, hepatitis, and typhoid. So we want to be able to help the people eliminate those diseases there because of the water. And it was really interesting. Out of the samples that they tested, the specimens, 81% of them contain single cell organisms that actually live in the intestines of humans and animals. And some of the samples, the worst ones, had 100 times the legal fecal matter, or the legal limit, of the fecal matter. So that was really quite a big problem. So we wanted to create these outhouses to have a safe place where people can dispel the human waste instead of dispelling it into the river. Next slide. And as the follow-up in our intervention, we believe that education of how to keep the environment clean will help the people stop that cycle and be able to teach the rising generation so that each new generation will be able to respect the environment and keep it clean. We also believe that knowledge is power, and if we help the people see what they can do about this problem and not have to wait on the government, they'll be able to make a bigger impact. A lot of the people feel like the government isn't doing their job, even though they aren't. There's a lot of corruption, and they're not seeing a lot of the promises that the government's made come true. So it seems like some of them has just been kind of waiting in helplessness for them to do something about it. So being able to teach them what they can do, I feel like would be very empowering for them. And also it would clean up the bodies of water and help them be more purified. And it would eliminate, well, we'd hope that it would eliminate disease and help the water become more usable, even if they could potentially use that and filter it to be able to have more drinking water, because that's one of the big problems in Ecuador is that many of the rural areas do not have adequate access to drinking water. And also, we feel that if you help people get more involved in the environment, they kind of take more action and have more determination to keep it clean because they are a part of it. And yeah, that could improve the quality of life with clean water. Next slide.
Okay, so then we had to talk about how we would go about implementing our intervention. And we talked a little bit briefly about how we might go about starting, but kind of organized it into about 6 steps. And the first one would be locating resources. So we have this idea, but we would need to get started in finding resources. And so part of that is funding the intervention. We need to decide how we're going to secure funding, if we're going to probably try to reach out to all of these public organizations, private organizations, and businesses and see if we can get donations. Other resources that might be useful would be having an office space or some place for meetings and planning sessions to happen. And we'd also need to figure out how we can get the equipment that we need. That might be tools for building, and then the supplies would be the building materials, and then staffing it with personnel. Also, just briefly, how can you, or who can help with funding and locating resources? We could turn to the government, especially local officials, businesses, especially in the local area, or a local area of Guayaquil, or even businesses on our end that would take an interest. There's educational institutions, hospitals, and healthcare facilities that have different services that they may be able to offer. And then volunteer, religious, and community service organizations also are more likely to help out with interventions such as this, and then looking out foundations as well. They're usually dedicated to philanthropic um, and would be able to help as well. Next slide, please. Step 2 would be trying to involve the community. As Mackenzie stated, that once the community gets involved and they see that this is something that will help them in the long run and something that they can really get behind, I think that the intervention would be more successful. So getting the community involved would be enlisting organizations and agencies that are familiar with the issue, getting input and support from influential individuals. Those could be high-ranking officials in the local government and cities. All of the groups that have committed to being a part of the intervention, we need to be able to coordinate our efforts and working with them, decide what they're going to be doing, how to keep them working together harmoniously, and then kind of dictate the lines of communication and the hierarchy, who they need to report to, and things like that. Step 3 would be to develop the activities and materials. So there are potential barriers that could get in the way. Culture is probably one of them, not just, you know, the problem that they've been using this river for how many years to do swimming, to dump to bathe, to dump their waste, to defecate or urinate in the water. And so we do face a barrier that it's going to be hard to stop that culture, but hopefully by educating them and providing the necessary activities and education on that, then we can kind of change that culture, change that viewpoint, or that mindset, I should say. Something that has been helpful in past interventions would be pre-testing. So one of the ideas that we had was perhaps instead of outright going out and just building all 40 of the outhouses that are our goal, maybe building a couple and kind of doing a trial run to see if we can build in that community and those communities that do have the outhouses, to see how receptive they are to them, if they use them, so that we can show our backers, the people who are helping to support and fund us, that this really is helping, and that we can proceed and build the rest of them, and it would be successful. Can we go to the next slide, please? So these are the last 3 steps in implementing our intervention. Step 4 would be staffing. We've touched on this a little bit, but we've kind of thought about who we might want to staff, but now we actually need to get the people there to help us with our intervention. And looking at that, we need to decide if there's any specific skill sets that we need. If we're going to, examples in other interventions might be registered nurses. In ours, we might need translators. If we don't have enough people who know Spanish themselves, we might need translators to be able to communicate with the locals. Those are kind of the things that we might need to look at in staffing. It's also based on our funding, though, because if we're well funded, we might be able to hire several paid staff members, which might help us with the translators especially. But if we aren't able to get the funding that we need and we have more limited resources, we'll probably have to enlist more volunteers than paid staff members. And then part of staffing is also training. We need to be able to communicate with the people that we've enlisted to help us, and they need to know what the process is and how to actually build the outhouses properly so that there's no problems structurally. And so we'd have to get the staff trained before we actually can go out and start building them, which leads us to step 5, getting started on actual implementation. Once we have everyone trained and can go out and start building those outhouses and a place for people to privately use the restroom, once we get out there and get going, we'll have to be able to supervise and support our staff, monitor their progress, and also evaluate the progress to see if there are any barriers that we didn't originally think of in building. I guess one of the things that we might run into is how well the soil holds the structure together and things like that. If we're having problems with staffing and there not being enough people, or if there are issues in the hierarchy of staffing, Step 6 would be to evaluate the whole program after it's been implemented to see if it's actually being successful. And so that's how we would go about implementing our intervention.